Hello, I'm Ondina Love, CEO of the Canadian Dental Hygienists Association. We're trying something new with our first ever video version of our Advocacy in Action news report. In the next 8 minutes, I'll present CDHA's latest advocacy efforts and highlights. Up first is the federal government's investments in dental care. Since new investments in national dental care were first announced by the Prime Minister over a year ago, CDHA has been actively and continually engaged with the Office of the Health Minister and his federal colleagues. Most recently, the 2023 federal budget, released at the end of March, tabled $13 billion over 5 years and $4.4 billion ongoing to Health Canada to implement the Canadian Dental Care Plan. The plan is expected to begin providing coverage by the end of this year for uninsured Canadians with annual family income of less than $90,000, with no copays for those with family incomes under $70,000. The budget also proposes money for an oral health access fund that will invest in targeted measures to address oral health gaps among vulnerable populations and reduce barriers in accessing care. The budget also outlined provision for data collection on oral health and access to dental care in Canada. Until more details are announced on these initiatives, CDHA will continue to take part in government consultation process to help shape a successful long-term national plan with a focus on increasing access to oral health care for vulnerable Canadians. At our end, our ongoing efforts are spent informing government on the design and implementation of the new National Dental Care Plan with the goal of advancing equitable access to preventive care and dental hygiene services to eligible populations. Next, our work on seniors included a recent forum with the Federal Minister of Seniors, Kamal Khera. The minister met with CDHA's board of directors and staff during our annual lobby day in Ottawa, which I'll cover more later. Many of you, as members, have entrusted CDHA to focus on seniors as an advocacy priority. This also takes into account supporting people living in long-term care homes across the country. Earlier this year, new national standards for long-term care were published by the Health Standards Organization. Collectively, CDHA as a national professional association and many of you as frontline oral health care providers took part in public engagement activities to support the development of the standard with dental hygiene perspectives. CDHA was pleased to see that our recommendations regarding oral health assessments was reflected in the published standards as it relates to the evaluation of each resident's physical needs. Beyond promoting the implementation of the new standard, our main focus is calling on the integration of dental hygienists as part of the long-term care staffing in all homes to foster a collaborative care team approach to ensure high-quality, comprehensive, resident-centered care. Next is our ongoing focus on student loan forgiveness for dental hygienists. Currently, the Government of Canada offers student loan forgiveness to eligible family doctors and nurses who work in underserved rural or remote communities lacking primary care. CDHA has been advocating for many years for the federal government to expand this program to dental hygienists. Unfortunately, the latest budget announcement did not come out with any details about the planned expansion to the list of eligible professionals. However, we understand that government is continuing to examine eligible professions for loan forgiveness, which means there's still work for us to do through continued advocacy, engagement, and collaboration. After 2 years of virtual lobby days in 2021 and 2022, CDHA's board of directors was thrilled to be face-to-face with members of parliament and other officials. Some of our meetings included high-ranking government officials such as the Parliamentary Secretary to the Minister of Health, featured here in this picture, the Federal Minister of Seniors, Kamal Khera, the leader of the Federal New Democratic Party, Jagmeet Singh, and the health critic of the federal NDP, Don Davies, to name a few. We met with 19 officials in one of the most successful lobby days ever. Many officials expressed their gratitude with social media posts chronicling the meetings. I encourage you to view these on our YouTube channel. MPs Don Davies and Rechi Valdez each recognized the profession and National Dental Hygienist Week in the House of Commons. You can view these videos on our YouTube channel as well. While the CDHA Board of Directors and senior staff have been hard at work advocating on the importance of oral health for general health, it has increased awareness across the country. This is affording CDHA members the opportunity to expand on this work at a grassroots level. Here are just a few examples that occurred just this past month. Cindy Holden, CDHA's Newfoundland and Labrador Director and the Newfoundland and Labrador Dental Hygiene Association were invited to participate in an NDP roundtable and press conference with Jagmeet Singh. St. Clair College dental hygiene students spoke with the leader of the NDP, Jagmeet Singh, when he toured the college and dental facility on April 11th. Linda McEwen participated in a press conference in Thunder Bay with former Health Minister and currently Minister of Indigenous Services, Patty Hajdu. University of Manitoba dental hygiene students spoke with Karina Gold, Minister of Families, Children and Social Development, at a press conference and facility tour. Olden College dental hygiene students spoke with Prime Minister Justin Trudeau and Minister of Official Languages Jeanette Petitpas-Taylor at a Moncton press conference and tour. And at Camosun College in Victoria, BC, dental hygiene student and CDHA student rep Riley Mayhew and CDHA past president Mandy Hare participated in a press conference and tour of the college with Minister of Health Jeannie Duclos, where the minister specifically singled out dental hygienists as being essential to the delivery of the new dental hygiene program because of our ability to reach rural and remote areas. Lots to celebrate as we all work together to be a hashtag voice for oral health. Building on the success of our lobby day and to kick off National Dental Hygienist Week on April 4th, CDHA held a press conference in the Parliamentary Press Gallery where we released new public polling data following the dental care announcement in the federal budget. Polling conducted for CDHA by leading market research experts Advocacy data showed overwhelming support for the new federal dental care plan, but raised concerns about the quality of oral health care in long-term care homes and other issues. The data shows that Canadians want improved access to oral health care, particularly for vulnerable populations, and you can read the details of the report at the link provided on the screen. Reporters from the Globe and Mail and the Canadian Press attended this press conference in person and were actively engaged with insightful questions, and there were others that joined, watched virtually or viewed the recording. We encourage you to view the video of the press conference on our YouTube channel at www.youtube.com/user/the CDHA. The event generated 17 news segments from across the country, across all mediums, radio, television, and print, including CTV News, Globe and Mail, and Toronto Star. As you can see, CDHA is fully invested in our quest to advancing the profession and fulfilling its mission of ensuring that all people living in Canada have equitable access to quality preventive and therapeutic dental hygiene care. Let us know what you think. With more than 21,000 members, we know that there will be a range of diverse preferences for ways to stay engaged with our communications, so we invite your feedback. And as we work to keep you informed on various aspects of CDHA's work, we'll continue to explore and evaluate ways forward with respect to updates from us for you, our valued members. Thank you.